Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You say one thing, and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective." In your testimony today, in order to prove you're not anti-vax, you note that all your kids are vaccinated. But in a podcast in 2020, you said, and I quote, "You would do anything, pay anything to go back in time and not vaccinate your kids." Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine, or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast and will see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective, and I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right, so
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden, so bringing this up right now is dishonest.
Let's be clear about what you've actually done then, since you want to deny your statements. For example, you have a history of trying to take vaccines away from people. In May of 2021, you petitioned the Food and Drug Administration to not only block Americans from having access to the COVID vaccine, but to prevent any future access to the life-saving vaccine. Are you denying that? Your name is on the petition.
We brought that petition after CDC recommended the COVID vaccine without any scientific basis for 6-year-old children. Most experts agree today, even the people who did it back then, that COVID vaccines are inappropriate for 6-year-old children who basically have a zero risk from COVID. That's why I brought that lawsuit. I also want to point out that your recitation of what happened in Samoa is absolutely wrong, and you know it's wrong.
We'll get to that in a moment. Right now, we're talking about the petition that you filed to block Americans from having access to the vaccine and to prevent any future access to the vaccine. Those facts are on the record. My third question to you is, you made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
The death rate from measles historically in this country in 1963, the year before the introduction of the vaccine, was 1 in 10,000. Let me explain what happened in Samoa. In Samoa in 2017 or 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I went there, nothing to do with vaccines. I went there to introduce a medical informatics system that would digitalize records in Samoa and make health delivery much more efficient. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. I went in June of 2019. The measles outbreak started in August. Oh, clearly I had nothing to do with the measles. Not only that,
Mr. Kennedy,
Senator, not only that, if you let me finish, Senator.
You have had some time.
If you let me finish, Senator, if you let me finish, there are 83 people died. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died. There were 7 measles outbreaks in the 13 years prior to my arrival.
I just would like to get my time back. The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
We need to move
Senator,
on.
I support the measles vaccine. I support the polio vaccine. I will do nothing as HHS secretary that makes it difficult or discourages people from taking either of those
Anybody
vaccines.
who believes that ought to look at the measles book you wrote saying parents have been misled into believing that measles is a deadly disease. That's not true.
Mr. Kennedy, President Trump has sworn to protect Medicare. Republicans are exploring reforms to Medicaid that could help pay for Trump administration priorities. With this context, what will you do about dual eligibles?
About
dual eligibles?
Well, dual eligibles are not right now served very well under the system. Those are people who are eligible for both Medicaid and Medicare. I suppose my answer to that is to make sure that the programs are consolidated, that they're integrated, and the care is integrated. I look forward to working with you, Dr. Cassidy, on making sure that we take good care of people who are dual eligible.
And how do you propose that we integrate those programs? Does Medicare pay more, Medicare pay less, Medicaid pay more, Medicaid pay less? How do we do that?
Well, I'm not exactly sure because I'm not in there. I mean, it is difficult to integrate them because Medicare is under fee-for-service. It's paid for by employer taxes. Medicaid is fully paid for by the federal government, and it's not fee-for-service. So I do not know the answer to that. I look forward to exploring options with you.
Republicans, again, are looking at ways to potentially reform Medicaid to help, pay for President Trump's priorities, but to improve outcomes. What thoughts do you have regarding Medicaid reform?
Well, Medicaid is not working for Americans, and it's specifically not working for the target population. Most Americans like myself, I'm on Medicare Advantage, and I'm very happy with it. Most people who are on Medicaid are not happy. The premiums are too high. The deductibles are too high. The networks are narrow. The best doctors will not accept it in the best hospitals. And particularly, Medicaid was originally designed for a target population of the poorest Americans. It's now been dramatically expanded. And the irony of the expansion is that the poorest Americans are now being robbed. Their services have dramatically decreased, even though we've increased the price of Medicare by 60% over the last 4 years. The target population is being robbed.
With that
figure
said,
out other options.
Obviously, you've thought about that, and I appreciate that. What reforms do you recommend, again, that would improve services, I suppose, but also make it more cost efficient?
Well, President Trump has given me the charge of improving quality of care and lowering the price of care for all Americans. There are many things that we can do. What we want to, the ultimate outcome, I think, is to increase transparency, to increase accountability. and to transition to a value-based system rather than a fee-based system,
So on
rather than a
Medicaid,
service-based
on
system.
Medicaid in particular, can you just kind of take those kind of general principles and apply it to the Medicaid program?
Listen, I think that there are many options with telemedicine, with AI right now. And, there's including direct primary care systems. We're seeing that movement grow across the country. There's one of the largest providers.
So going back to Medicaid though, and speaking of these specific advances, what reforms are you proposing with these ideas vis-a-vis Medicaid?
Well, I don't have a broad proposal for dismantling the program.
Of course not saying that.
I think what we need to do is we need to experiment with pilot programs in each state. We need to keep our eye on the ultimate goal, which is value-based care, which is transparency, accountability, access.
And one more thing, going back to Medicare, you mentioned you're an MA. You mentioned earlier the Medicare fee-for-service. Do you have any kind of thoughts as to whether or not patients on fee-for-service should move into MA, or how should we handle that?
Whether patients
who are on Medicare
and
fee-for-service.
traditional Medicare,
Yes.
that's their choice right now. We have, I think, 32 million Americans, or 30 million Americans on Medicare, on traditional Medicare, and then another 34 on Medicare Advantage, roughly half and half. And I think more people would rather be on Medicare Advantage because it offers very good services, but people can't afford it. It's much more expensive. In answer to your first question, there are all kinds of exciting things that we can be doing, including cooperatives, which President Trump has supported, including health savings accounts, which President Trump has supported. All of these things to make people more accountable for their own health.
And so we'd bring the cooperatives and the health savings accounts into Medicare and Medicaid?
Exactly. We try to increase those, the use of those, and to direct primary care, to continue to transition into a value-based program that is private. Americans don't, by and large, do not like the Affordable Care Act. People are on it. They don't like Medicaid. They like Medicare. And they like private insurance. We need to listen to what they would prefer to be on private insurance. Most Americans, if they can afford to be, will be on private insurance. We need to figure out ways to improve care, particularly for elderly, for veterans, for the poor in this country. And Medicaid, the current model is not doing that. I would ask, any of the Democrats who are chuckling just now, do you think all that money, the $900 billion that we're sending to Medicaid every year, has made Americans healthy? Do we think it's working for anybody? Are the premiums low enough?
We do need to move on. Senator Warner.
Well, I got to tell you, for literally hundreds of thousands of Virginians, Medicaid is what prevents them from health crises on a daily and weekly basis. And some imaginary new plan, and if there was a new plan that was to be the basis of what Trump was going to do when repealing Obamacare, I would have thought by now we'd have seen it. I got to tell you, listen,
Senator, can I reply to that?
Senator, Mr. Kennedy, I got questions. I appreciate our visit. I know you take your views seriously, and I don't reflexively vote. I voted for 4 of President Trump's nominees already. Got a lot of grief from folks on this panel. But I got to tell you, I saw an email that you put out Monday night, or your campaign did, in a fundraising email. Your presidential campaign celebrated that the freeze on all new regulations, guidance, and announcements is a way to protect unelected bureaucrats from further undermining our health freedom. Then you ask your donors to help pay for your campaign debt. Did your campaign and you put out that?
I don't think my campaign exists anymore.
All right, well, listen, I got to tell you this. Somebody's out there soliciting money for it. Maybe you ought to find out who is. So the fact that you celebrate this freeze, do you think that was a good idea to put all of this on hold for 90 days? Funding and any kind of further work? NIH research?
As Chairman Crapo pointed
What
out.
do you, I'm not asking for, I love Mike Crapo. I'm asking you. You're up very, very important position.
As he pointed out, Senator, the
Let me
portals
just-
that were closed were not closed as a result of the Trump
Let me just tell you,
administration's
I'd like you to
purposeful
explain, excuse me,
policy.
sir, I'd like you to explain to a domestic violence center in Richmond that's saying because this freeze, they may have to close down, where those battered women to go. Or a rural nonprofit I've got in the Shenandoah Valley who's saying that freeze is going to potentially shut down their ability to operate. So I guess if you deny or don't know what your campaign's sending out, you don't know if you raised a lot of money Monday night with your email.
I'm saying that the Trump
You don't
administration
know if
has-
you raised a lot of money.
the Trump administration has made clear that it does not want to freeze benefits
All right,
for
excuse me.
any Americans under Medicaid or Medicare, and I do not want to
There
dismantle
are,
Medicaid.
the freeze is
Neither-
affecting beyond Medicare and Social Security. I would hope you would have known that to be able to answer some of this. Now, you've said publicly, you want to immediately get rid of 600 NIH workers on job one, on day one. When we had our meeting, you said you'd actually like to get rid of 2,200 people from HHS. Which offices are you going to start cutting and riffing these 2,200 workers from?
Senator, there's 200 political appointees that are changed during every administration.
So if you got rid of those 200 political appointees, you're not going to replace them with your political appointees.
Well, President Biden this year changed 3,000 employees at HHS, 3,750
So
at NIH.
your 2,200, what departments are you going to pick them from?
Well, the same as President Biden did when he changed 3,000 out. They're from all across all
I'm down to a
departments.
minute 30. The chairman's been generous with colleagues on both sides and may have to go a couple minutes over. But let me just say, so let's just answer, this would be, this. I hope, since you're asking to become the top healthcare official in the United States in terms of HHS, huge ramifications, and part of this job is to be the senior advisor to the president on health issues. So when we're looking at this purge and we're looking at laying off workers, when we're looking at potentially the president's illegal offer to try to buy out federal employees, which I would say to any federal employees, think twice. Has this individual in his business world ever fulfilled his contracts or obligations to any workers in the past? But if you are in this position, will you pledge that you will not fire federal employees who work on food safety, work on trying to preventing things like salmonella?
Senator, there are 91,000 employees.
So that I take that as a, that's a simple yes, and I'm going to take that as a no.
Run that agency
I take that as a no. Will you actually? We talked about protecting Americans from cyber criminals, something we need to do a lot more on. Will you commit not to fire anyone in the health arena who currently works on protecting Americans from cyber attacks in their healthcare files?
I will commit to not firing anybody who's doing their job.
Based on your opinion, based upon your opinion, or your political agenda, or Mr. Trump's political agenda?
Based upon my opinion.
So I guess that means a lot of the folks who've had any type of views on vaccines will be out of work. Will you freeze grant funding for community health centers? Will you freeze federal funds for community health centers, the way the current administration has done?
The White House has made clear that no funds are going to be denied to any American for benefits in any program.
Do you know what happens at community health centers? Those are direct.
Are you talking about the Indian health centers?
No, I'm talking about community health centers across the country.
I understand that. I mean, I strongly
So you're going to
support-
excuse Indian health centers, which is good, but others are not. They're going to get their funds frozen.
I strongly support community health centers, as does the president. He
So does that
not
mean
want-
you're not going to freeze the funding that is currently frozen?
The White
Or
House
work
has
on
made
freeze it?
clear that none of that funding is supposed to be frozen.
Sir, the direct payments are different than how the government operates. We fund the federal government down to community health centers. As a former governor, there's lots and lots of state programs that are related to health care that come from the federal government, they come down to the state, then it goes to local programs. All of those don't directly pay out $1 at a time, but they come from federal funding. They are all, even though they keep changing the guidance on a minute-by-minute basis, based upon 9:45 or 10:30 or 10:45, whatever time it is today, those funds are still frozen. Sir, I just honestly, I want to give you a fair shot, but I don't feel like you approach this job with the knowledge and candidly your willingness not to commit. Try to recommend to the president to make sure these funds are unfrozen and that people's lives are at stake is a very disappointing answer. Thank you, Mr. Chairman.
Mr. Kennedy, I only have 5 minutes with you, and I've got a lot of experience with CMS, so you're just going to have to listen. 2 things. One, if you want to move from advocacy to public responsibility, Americans are going to need to hear a clear and trustworthy recantation of what you have said on vaccinations, including a promise from you never to say vaccines aren't medically safe when they in fact are, and making indisputably clear that you support mandatory vaccinations against diseases where that will keep people safe. You're in that hole pretty deep. We've just had a measles case in Rhode Island, the first since 2013, and frankly, you frighten people. 2, I want to air harms that Rhode Island has experienced from a remorseless, senseless CMS bureaucracy. CMS has for years maintained a reimbursement system that the bureaucracy could never explain, never justify, that persistently pays Rhode Island providers less than neighboring Massachusetts and Connecticut providers. A differential of 23 and 26% in our regional healthcare market. The Pending Ahead program can begin to remedy this, at least for value-based care, and it must. There has to be payment parity in the region. Rhode Island's healthcare system is bleeding out because we aren't paid what neighboring hospitals and doctors are paid, and the one act CMS took on this years ago was to make it worse. The CMS bureaucracy has also attacked one of the best accountable care organizations in the country, Rhode Island's Integra Family Doctors. Tried to throw them off the shared savings program because they said Integra years ago briefly fell 137 patients short of the 5,000 patients that ACOs need. CMS wouldn't listen until a court found that to be unjustified, likely illegal, irreparable harm to this high-performing ACO and its patients, and contrary to the public interest. That must stop. Last, CMS has refused to approve waivers granted elsewhere for Rhode Island from rules that are stupid for Medicare patients who are nearing the end of their days. Here's what families see. Granny is home dying. She needs to transfer to a nursing home, and Medicare insists on putting her 3 days and 2 nights in a hospital. Expensive, frightening to Granny and the family, and stupid. Granny's home dying and can't get palliative and curative care together. Inhumane and stupid. Granny's home dying and can't get home care if she can still get out into the yard or be driven to see the shore, to see Narragansett Beach, say, one more time, to recall childhood memories before she dies. Inhumane and stupid. Granny's home dying and the family's exhausted. And the respite care benefit is not to send a nurse or a caregiver, but to stuff Granny in an ambulance and haul her off to a hospital. Some respite. It's all expensive, frightening, inhumane, and stupid. But the insensate CMS bureaucracy takes a court order to be awakened to the harm they cause. I have had enough. CMS should let Rhode Island try humane end-of-life care through CMMI. Let's see if it works at a state. I bet it will save money, serve families better at a very, very delicate time, and perhaps even make a model for better health care everywhere. I've said a lot. My time is out. You're welcome to respond in writing. I ask unanimous consent that the order declaring CMS's actions to constitute irreparable and illegal harm be put into the record.
Without objection.
Let me just respond very briefly, Senator Whitehouse. I'm an implacable enemy of tyrannical, insensate bureaucracies and stupid rules, and I will work with you to make CMS responsive to the needs of Rhode Island and to remedy those disparities that you talk about. I am familiar with the Integra Health plan, and it is the template for what we ought to be doing is a value-based plan. And I look forward to you to making sure that we create pilot programs like this.
Unfortunately,
that can be
Mr. Chairman,
reproduced around the country.
Unfortunately, Mr. Chairman, one of the things I've learned in my tenure in the Senate is that a nominee saying that they're willing to work with me amounts to exactly zero. We need to get this fixed. Thank you.
I want to start with a couple of concerns I have, and just briefly on Medicaid. States share in the funding of Medicaid. Millions of disabled children in this country are alive because of Medicaid. Millions of people with addiction in this country are in recovery because of the services provided to them by Medicaid. And millions of chronically ill people who, until Medicaid expansion was enacted, who couldn't get health care and therefore couldn't work because they were too sick, got health care through Medicaid expansion, then went back to work, and now they're on private insurance. So those are some facts about Medicaid that you might want to brush up on. Now, I'm also extremely concerned about your endorsement of radical fringe conspiracies that, if implemented at HHS, would put American families' lives at risk. Vaccines are one of our greatest public health triumphs. And you don't need, I'm not talking about abstract medical science. One of the people who helped raise me was my grandfather, who was a pediatrician. He practiced medicine in this country from 1921 until the mid-1980s. And I heard details about the difference those vaccines made in saving lives in the children who were under his care. Vaccination has helped to eradicate many deadly diseases in the United States, including polio and smallpox, something we should be proud of as Americans. I am extremely concerned that as Secretary, you would be able to halt critical vaccine research and to exploit parents' natural worries by advising them not to vaccinate their children. This will lead to more children getting sick, and some will even die. Before the measles vaccine, about 500 American children died a year from measles. This is too much of a risk for our country, and there is no reason that any of us should believe that you have reversed the anti-vaccine views that you have promoted for 25 years. For example, you have previously falsely suggested that the polio vaccine killed many, 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 many more people than polio ever did by causing fatal cancers, while rigorous safety studies show that to be completely false. Now, let's go to something we agree upon. I am really heartened to see that one area where we agree on is on women's reproductive freedom. In your own words, it's not the government's place to tell people what to do with their bodies. You said that, correct? Yep. Mr. Kennedy, in 2023, you came to New Hampshire and said, quote, I'm pro-choice. I don't think the government has any business telling people what they can or cannot do with their body. So you said that, right?
Yes.
Yep. But you also said we need to trust the women to make that choice because I don't trust government to make any choices. You said that too, right?
Yes.
It is remarkable that you have such a long record of fighting for women's reproductive freedom, and really great that my Republican colleagues are so open to voting for a pro-choice HHS secretary. So, Mr. Kennedy, I'm confused. You have clearly stated in the past that bodily autonomy is one of your core values. The question is, do you stand for that value or not? When was it that you decided to sell out the values you've had your whole life in order to be given power by President Trump?
Senator, I agree with President Trump that every abortion is a tragedy, that we can't be a moral authority in this country.
Right, so, but that isn't what you said back in New Hampshire in 2023. My question is exactly when did you decide to sell out your life's work and values to get this position?
Senator, I agree with President Trump that every abortion is a tragedy.
So what you're telling us, just to be clear, because my time is limited, is that regardless of what you believe, regardless of what values you have, if President Trump tells you to do something, you're going to do it. You said just now the discussion about mifepristone. Oh, he's asked me to study the safety of it. Here are the safety studies that tell us mifepristone is safe and effective. And I asked Mr. Chair that these about 40 studies be admitted to the record by unanimous consent.
Without objection.
So the studies are there. The safety is proved. The science is there. But what you're telling us is if President Trump orders you to take action to make it harder for women to get direly needed health care, you'll follow his order. If Mr. Trump, as he did yesterday, orders a halt on Medicaid payments that are essential for taking care of people with disabilities all around this country, you're going to follow that order because you are willing to sacrifice your values, your knowledge, if President Trump tells you to do that. That, to me, is unacceptable in a Secretary of Health and Human Services.
As I explained before, the White House has issued a statement saying that that policy will not deprive any American of benefits.
The problem is the White House issued that statement only after we pointed out the damage it would do, and it became politically uncomfortable for them. You know what else that freeze on federal funding did? It halted funds for critical research that could cure pediatric cancer. So if the president tells you to do that, you're going to stop that too. That's enough.
Let me ask you a couple of questions, though I just need some clarification. Right now, there's a 40-year-old law that requires hospital ERs accepting payment from Medicare to actually provide emergency care to patients. So let's say a woman experiencing a life-threatening condition like a heart attack goes to the ER. As a lawyer, you would agree that that federal law protects her right to emergency care, correct?
Yes.
So now a pregnant woman with life-threatening bleeding from an incomplete miscarriage goes to the ER. Let me rephrase that so you can hear. A pregnant woman with a life-threatening bleeding from an incomplete miscarriage goes to the ER, and her doctor also determines that she needs an emergency abortion. But she's in a state where abortion is banned. You would agree also as an attorney that federal law protects her right to that emergency care, correct?
I don't know. I mean, the answer to that is I don't know. If the state bans
Well, let me ask you this as an attorney. Doesn't federal law preempt state law?
The federal Constitution does. Sometimes not every federal law preempts state laws. It could be unconstitutional. Now, I'm not trying to be evasive,
Case, let me ask you
Senator. I'm
this.
just telling you I don't know the
I
answer
appreciate
to
that.
question.
But what authority do you have over this as the director of HHS?
What authority do I have?
Yeah, to enforce the law.
In what regards?
To make sure that a hospital that receives payment from Medicare is ensuring that they're providing the necessary emergency care to patients when they present. It's actually the EMTALA law. So what authority as HHS director do you have with respect to EMTALA?
My understanding is that I have budgetary power and that it's pretty much limited to that. But if you tell me I have another authority, I don't even think that
Well, let me tell you,
we
you
have
do.
a law enforcement branch at HHS.
Actually, you do, and that's CMS. CMS actually investigates complaints of EMTALA violations, as well as the Health and Human Services Inspector General, who, by the way, was just recently fired by Donald Trump. So you will be enforcing EMTALA laws, and it's important that you understand their impact and don't play politics with the patient presenting at the ER based on a position that this administration has taken. Let me ask you another question. When we met in my office, you said about lowering drug prices, that when Big Pharma price gouges, the American people suffer. I think we both agree on that. And I think you're sincere in your belief that you want to reduce prices for Americans, correct?
Yes.
Yeah. The Inflation Reduction Act empowered Medicare to negotiate prescription drug prices. It penalizes drug companies for price hikes above inflation, and it caps seniors' out-of-pocket drug costs, along with reducing insulin prices to $35 per month. But your future boss, Donald Trump, on his first day in office, revoked President Biden's executive order that actually directed the health secretary to examine ways to reduce drug prices and improve access to innovative therapies for the American people. And unfortunately, Republicans in Congress want to repeal the Inflation Reduction Act, which means reversing all of those things that we worked on to lower prices for Americans. So my question to you is, what do you do? Why are you there? Are you there to be a rubber stamp to this administration and cave into all of these positions that they're taking, even though you know they're in disagreement with your positions on lowering drug prices and that they could harm Americans? How do you handle that as HHS director?
Senator, my understanding is that the White House issued an executive order, I believe today, supporting the drug negotiations under the IRA. President Trump was very aggressive during his first term about negotiating drug prices. He has instructed me, and I've met with him repeatedly on as that we need lower prices than seniors in this country, and
So let me ask
others
you,
are.
let me ask you this, because I only have so much time. So we've already negotiated lowering prices for 10 drugs with Big Pharma. And Big Pharma, by the way, opposes this. They have not only are asking for a pause, they have filed lawsuits, but we've already negotiated the first 10 drugs. And we want to expand it to the next 10 to 15 that the Biden administration has put forward. Would you agree and continue that path of really mandating that Big Pharma come to the table and negotiate drug prices for Medicare so we can lower those prices for Americans?
My understanding is that the executive order that was issued today, which I haven't seen, but I've read a summary.
Well, let me ask you this then, because you keep citing the Trump administration and you're just going to follow what they say. Is that what you're doing? You're just a rubber stamp for them in this position? So anybody,
Trump.
so it doesn't matter that you're before us. It could be anybody coming before us as long as they're a rubber stamp for this administration and disregarding your beliefs and what you think. I guess my question to you is, if it really is fundamental to what you believe, how do you live with that? How do you address those issues as you're moving forward,
You want me to
knowing
answer
that
the
it's going to
question,
harm
Senator?
Americans? Yeah.
You want me to answer the question?
No, I'm asking you.
Okay. President Trump has asked me to end the chronic disease epidemic and make America healthy again. And I'm
So
in a
is that the
unique
only reason why
position.
you're at HHS? Is that the
Excuse
only
me.
reason why then you're at the HHS to address that one issue?
President Trump has asked me because I'm in a unique position to end that. And that is what I'm doing. And if we don't solve that problem, Senator, all of the other disputes we have about who's paying and whether it's insurance companies, whether it's providers, whether it's HMOs, whether it's patients or families, all of those are moving deck chairs around on the Titanic. Our ship is sinking. our 60% increase in Medicaid over the past 4 years is the biggest budget line now, and it's growing faster than any other. And no other nation in the world has what we have here. No other nation has a chronic disease. We have the highest chronic disease burden of any country in the world. We had, during COVID, we had 16% of the COVID deaths in a country. We only have 4.2% of the world's population. We had a higher death count than any country in the world. And when CDC was asked why, they said it's because Americans are the sickest people on earth. The average person who died from COVID, American, had 3.8 chronic diseases. This is an existential threat economically to our military, to our health, to our sense of well-being. And it is a priority for President Trump. And that's why he asked me to run the agency. And if I'm privileged to be confirmed, that's exactly what I'll do.
You said that President Trump asked you to, quote, clean up corruption and conflicts. Sounds great. You've said that you will, quote, slam shut the revolving door between government agencies and the companies they regulate. That also sounds great. So here's an easy question. Will you commit that when you leave this job, you will not accept compensation from a drug company, a medical device company, a hospital system, or a health insurer for at least 4 years, including as a lobbyist or a board member?
Can you just repeat the last part of the question? Can I commit
You're
to
not
what?
going to take money from drug companies in any way, shape, or form.
Who? Me?
Yes, you.
Oh. Yeah, I'm happy to commit to that.
Okay, good. That's what I figured. I said it's an easy question to start with. And I think you're right on this question.
I don't think any of them want to give me money, by the way.
Let's keep going. You're right because to say yes, because every American has the right to know that every decision you make as our #1 health officer is to help them and not to make money for yourself in the future. So I want to talk more about money. I'm looking at your paperwork right now. In the past 2 years, you've raked in $2.5 million from a law firm called Wisner Baum. You go online, you do commercials to encourage people to sign up with Wisner Baum to join lawsuits against vaccine makers. And for everyone who signs up, you personally get paid. And if they win their case, you get 10% of what they win. So if you bring in somebody who gets $10 million, you walk away with $1 million. Now, you just said that you want the American people to know you can't be bought. Your decisions won't depend on how much money you could make in the future. You won't go to work for a drug company after you leave HHS. But you and I both know there's another way to make money. So, Mr. Kennedy, will you also agree that you won't take any compensation from any lawsuits against drug companies while you are secretary and for 4 years afterwards?
Well, I'll certainly commit to that while I'm secretary. But I do want to clarify something because you're making me sound like a shill. I put together that case. I did the Science Day presentation to the judge on that case to get it into court, the Daubert hearing.
Mr. Kennedy, it's just a really simple question.
Yeah,
You've taken in $2.5 million. I want to know if you will commit right now that not only will you not go to work for drug companies, you won't go to work suing the drug companies and taking your rake out of that while you're a secretary and for 4 years after. It's just...
I'll commit to not taking any fees from drug companies while I'm secretary.
No. I'm asking about fees from suing drug companies. Will you agree not to do that?
You're asking me to not sue drug companies,
No,
and I'm not going to agree to that,
drug
Senator.
companies as much as you want.
I'm not going to agree to not sue drug companies or anybody.
So let's do a quick count here of how, as Secretary of HHS, if you get confirmed, you could influence every one of those lawsuits. Well, let me start the list. You could publish your anti-vaccine conspiracies, but this time on U.S. government letterhead, something a jury might be impressed by. You could appoint people to the CDC vaccine panel. who share your anti-vax views and let them do your dirty work. You could tell the CDC vaccine panel to remove a particular vaccine from the vaccine schedule. You could remove vaccines from special compensation programs, which would open up manufacturers to mass torts. You could make more injuries eligible for compensation even if there is no causal evidence. You could change vaccine court processes to make it easier to bring junk lawsuits. You could turn over FDA data to your friends at the law firm, and they could use it however it benefited them. You could change vaccine labeling. You could change vaccine information rules. You could change which claims are compensated in the vaccine injury compensation program. There's a lot of ways that you can influence those future lawsuits and pending lawsuits while you are Secretary of HHS, and I'm asking you to commit right now that you will not take a financial stake in every one of those lawsuits so that what you do as Secretary will also benefit you financially down the line.
I'll comply with all the ethical guidelines.
That's not the question. You and I, you have said
You're asking me, Senator, you're asking me not to sue vaccine pharmaceutical companies. Yeah, you are. That's exactly what you're doing.
Look, no one should be fooled here. As Secretary of HHS, Robert Kennedy will have the power to undercut vaccines and vaccine manufacturing across our country. And for all of his talk about follow the science and his promise that he won't interfere with those of us who want to vaccinate his kids, the bottom line is the same. Kennedy can kill off access to vaccines and make millions of dollars while he does it. Kids might die, but Robert Kennedy can keep cashing in.
Senator, I support vaccines. I support the childhood schedule. I will do that. The only thing I want is good science, and that's it.
How about then say you won't make money off what you do as Secretary of HHS?
Mr. Kennedy, thanks for being with us. I very much like the slogan that you coined, Make America Healthy Again. And I strongly agree with that effort. Despite spending, as you indicated, 2 or 3 times as much per capita on healthcare as other nations, we have 85 million people who are uninsured, underinsured. We have all kinds of chronic illnesses. Our life expectancy is lower than other countries. And for working class people in this country, they are living 6, 7 years shorter lives than the top 1%. We got a problem, okay? And I'm going to suggest some ideas that I think can remedy that. Last year, the insurance industry in this country made over $70 billion, while at the same time, 85 million Americans are uninsured or underinsured. Do you agree with me that the United States should join every other major country on earth and guarantee health care to all people as a human right? Yes? No?
Senator, I can't give you a yes or no answer to that question.
Health care a human right? Is health care a human right?
In the way that free speech is a human right,
yeah.
I would say it's different because if with free speech doesn't cost anybody anything, but in healthcare, if you smoke cigarettes for 20 years and you get cancer, you are now taking from the pool. Well, and so are you guaranteed the same right, or is there also a duty?
I'm sorry. I'd love to talk for an hour with you. We got a few minutes left here. All right. Every other country on earth says healthcare, whether you're poor or rich, young or old, is a human right. I'm not hearing you say that. All right. You've talked about the drug companies, and maybe we agree on this one. As you all know, despite the drug companies making over $100 billion in profits, paying CEOs outrageous compensation packages, we, in some cases, pay 10 times more for the same drug. Will you support legislation that I will introduce which says that in America we should not be paying a nickel more for prescription drugs than people around the rest of the world? Yes, no?
To equalize it?
Not to equalize it, that we should not be paying more than other countries for the same damn drug.
President Trump it has asked me, in fact, I had a meeting with President Trump a week ago where we showed him the charts.
He knows the charts.
We're paying 10 times more from Europe.
That's right. And are you going to commit to us that you will end that absurdity?
I think in principle we can. We should end that disparity.
Good. Okay. That's great. All right. I happen to believe that climate change is real, it's an existential threat, and it is a healthcare issue. Donald Trump thinks that it is a hoax originating in China. Question is, in your judgment, is climate change a hoax or is it real, causing devastating problems?
President Trump and I, from the beginning, from our first meeting, agreed to disagree on that issue. I believe climate change is existential. My job is to make Americans healthy again.
All right, you believe that, you disagree with Trump, you don't think climate change is a hoax, is what I'm hearing.
My job here is to make
just
Americans
asking you that,
healthy.
Mr. Kennedy, not a trick question.
I answered your question, Senator Sanders.
Okay, you disagree with the president on that.
I answered your question.
Okay. I'm going to pick up on a point that Senator Hassan made. Look, there is no question that abortion is a divisive issue in this country. I would say a majority of the people are pro-choice. There's a strong minority who are pro-life. A year and a half ago, you went to New Hampshire, running for president, gave a speech, and you talked about government should not tell a woman what she can do with her own body. That's her choice. Now, I think everybody on that side is pro-life. I think everybody here is pro-choice. I have never seen any major politician flip on that issue quite as quickly as you did when Trump asked you to become HHS secretary. Tell me why you think people should have confidence in your consistency and in your word when you really made a major U-turn on an issue of that importance in such a short time.
Senator, I believe, and I've always believed, that every abortion is a tragedy.
But you told the people of New Hampshire that it was their right. All right, let me do a last question here because I'm running out of time. I think the gist of what you're trying to say today is you're really pro-vaccine, you want to ask questions. You have started a group called the Children's Health Defense. You're the originator. Right now, as I understand it, on their website, they are selling what's called onesies. These are little things, clothing for babies. One of them is titled Unvaxxed, Unafraid. Next one, and they're sold for $26 a piece, by the way. Next one is No Vax, No Problem. Now, you're coming before this committee and you say you're pro-vaccine. Just want to ask some questions. And yet your organization is making money selling a child's product to parents for $26, which casts fundamental doubt on the usefulness of vaccines. Can you tell us now that you will, now that you are pro-vaccine, that you're going to have your organization take these products off the market?
Senator, I have no power over that organization. I'm not part of it. I resigned from the board.
Yeah, that was just a few months ago. You founded that. You certainly have power. You can make that call. Are you supportive of this?
I've had nothing to do with leadership.
Are you supportive of these onesies?
I'm supportive of vaccines.
Are you supportive of this clothing, which is militantly anti-vaccine?
I am supportive of vaccines. I will. I want good science, and I want to protect.
But you will not tell the organization you founded not to continue selling that product. Thank you, Mr. Chairman.
Mr. Kennedy, when we met, you stated to me that it is not your goal to take away programs that work for Americans. Do you stand by that statement?
Yes, Senator.
Mr. Kennedy, do you know how many Americans rely on Medicaid?
It's about 72 million plus the 7 million kids who are on chips.
Appreciate that, 72 million. Yes or no, is it important that expectant mothers and newborns have access to health coverage? Is it important that expectant mothers and newborns have access to health coverage?
Absolutely, Senator.
Mr. Kennedy, do you know how many babies born in this country are covered through Medicaid?
I would guess, I don't know the answer, I would guess about 30 million.
I have it, Mr. Kennedy. About 41% or 1.4 million babies births are financed by Medicaid, according to the National Center for Health Statistics. Yes or no, do you believe that Medicaid is a critical program?
I believe that Medicaid is a critical program, but that it's not working as well as it ought to be. And President Trump has asked me to make it work better, that most Americans are not happy with it, that the premiums are too high, the deductibles are too high, and everybody's getting sicker. Too much money is going to
Mr.
the
Kennedy?
insurance industry.
I have a series of yes or no questions. They're pretty simple. Because you heard we're not going to get a second round of questions, I ask for your indulgence to be able to get through them yes or no. In New Mexico, as you know, Medicaid is often measured state by state. It might surprise you if you look at some of those surveys. In New Mexico, the response was 90% of New Mexicans on Medicaid report satisfaction getting care, 80% getting specialist care, 85% getting urgent care, 95% ease of filings out of focus. Not to pick on any one of my colleagues, but in Louisiana, 86% of people on Medicaid are satisfied with their interactions. 83% are satisfied getting care. 85% are satisfied getting specialized care. 82% getting urgent care. I can go on state by state, but we don't have the time today. Yes or no, do you support cutting Medicaid or reducing, and especially in an area where you and I spoke about with the federal investment in Medicaid, which is known as FMAP?
President Trump has not told me that he wants to cut Medicaid. He's told me to make it better.
Do you support cutting, yes or no? Let me ask you this way, since it's only about
I
President
support
Trump.
making it better, Senator.
If President Trump asks you to cut Medicaid, will you do it?
Oh, it's not up to me to cut Medicaid. It would be up to Congress. And
You don't want to
I'm going
answer?
to work. I'm going to work.
Mr. Kennedy, you don't want to answer? I'll move on. Do you know how many states will end? Mr. Chairman, if I may pause my time. So I understand that people are getting asked to leave if they stand up with signs, but there's a lot of other as well, Mr. Chairman. So it needs to be extended to everyone. As Mr. Kennedy said, we should respect each other when we have a difference of opinion. We're just trying to do our jobs here and trying to ask questions. That's all. And that's all I'm doing with Mr. Kennedy, folks. So I just hope that we can.
Senator Lujan, you are right, and I ask the audience to please be respectful.
Thank you, Mr. Chairman. I appreciate that very much. Mr. Kennedy, do you know how many states will end their Medicaid expansion if the federal share of Medicaid drops?
Well, there's 40 states that have signed on to the expansion. So,
It's a smaller number. So it's 9 states would quickly have to end their expansion because of the laws that they have. That's about 4 million folks across the country. And in New Mexico, Iowa, and Idaho, they have triggers that it would immediately have to go into effect if, in fact, that gets cut. The reason I'm asking those questions is there's been a lot of chatter and conversations around Medicaid. Now, I agree we can always do better, and we must be doing better in America. But Medicaid has been shown to improve health outcomes, including mortality, quality of life, and access to preventative care as well. And there's some areas, Mr. Kennedy, that you and I touched on specific to Native American communities. One of the concerns that I have are these programs matter to folks. You shared your passion about caring for folks. I believed that passion. My question in this area is, as you know, when folks are doing research and they're going to check to see if medicine works on someone, if they're not included in that trial, it often doesn't help them. That's what all the evidence shows. So what are you going to do when programs are eliminated to require the inclusion of Native Americans in clinical trials when it comes to life-saving medicine?
I'm going to do everything I can to make sure that there's Native Americans in clinical trials. As I said to you when I visited your office, I spent 20% of my career working on Native issues. My family's been deeply involved with them. My father and uncle were big critics of the Indian Health Service, a failure to deliver good health results or health care on the reservations. I'm going to bring a native, and for the first time in history, into my central office, that all the major decisions in my office will be that he will have it. We've already interviewed a candidate, a very, very good candidate, will have direct impact on all the major offices. One of my priorities is to improve.
I appreciate that. I have a follow-up in that space specifically. Will you commit to finalizing the congressionally mandated FDA guidance to increase clinical trial diversity?
Just repeat that again. I'm sorry.
Will you
Senator.
commit to finalizing the congressionally mandated FDA guidance to increasing clinical trial diversity?
Yes.
I appreciate that. Will you commit to reinstating all of the pages that were eliminated and people that were fired from this administration that have this responsibility?
I cannot commit to that because I don't know who they are.
Well, there's
I'll
some
commit
folks
to
out there doing the
working
work.
with you to make sure those positions are adequately staffed.
I will follow up in writing in those specific areas because I think there's some commonality here, but answers matter. And so I'd like to get those as timely as possible. The last thing, Mr. Chairman, that I'll say is one of the conversations I had last before this hearing was with a family that I've been working with to work with my Republican colleagues when it comes to autism and federal programs and making a difference in these families' lives and this little girl's life. What I'm asking now, Mr. Chairman, is unanimous consent to enter into the record an article from Autism Speaks titled, quote, "Do Vaccines Cause Autism?" End quote. And I'll note that the first sentence states, quote, "Vaccines do not cause autism," end quote.
Thank you so much, Chairman Crapo and Ranking Member Wyden. It's great to be here. Mr. Kennedy, welcome. Welcome to you and to your family. Thank you for meeting with me a few days ago. I'd like to follow up, if I might, with some of the issues that we discussed in my office. I want to talk to you first about the CDC, or the Centers for Disease Control and Prevention. I'm proud of the work that the CDC does, proud that it's located in Georgia with more than 10,000 employees in my state. If confirmed, you would be the cabinet secretary over the CDC. Representing HHS, it's about 29% of the federal budget. CDC is a part of that. Do you agree that the CDC's work is critical to Georgia, critical for our country, and the health of the entire world?
Yes, Senator.
Senator Isaacson, my Republican predecessor, would have agreed with that. Bless his memory. He was a fierce advocate for the CDC, as am I. The CDC is an agency filled with hard-working, dedicated public health servants. They wake up every single day working to keep us safe. I think we don't think often enough about their work, because it's easy not to celebrate the folks who are protecting you from that which doesn't appear because of the work that they're doing. So grateful for the work that the CDC employees do. Some of them are members of my church. I saw that deep commitment firsthand when I visited the CDC just last summer. Mr. Kennedy, you have compared the CDC's work to Nazi death camps. You've compared it to sexual abusers in the Catholic Church. You've also said that many of them belong, this is a direct quote, many of them belong in jail. For me, those are disturbing characterizations of the CDC workers that I know who are trying to keep the American public safe every single day. And as you are presented as the nominee for this position, I need to know, do you stand by those statements that you made in the past, or do you retract those previous statements?
Senator, I don't believe that I ever compared the CDC to Nazi death camps. I support the CDC. My job is not to dismantle or harm the CDC. My job is to empower the scientists if I'm privileged to be confirmed.
So you retract those statements?
I'm not retracting it. I never said it.
Well, actually, I have a transcript.
Of me saying that it's a Nazi death camp?
Yeah, let me read your words. It says that the institution, CDC, and the vaccine program, is your description of their work, is more important than the children that it's supposed to protect. And you know, it's the same reason we had a pedophile scandal in the Catholic Church. It's because people were able to convince themselves that the institution of the church was more important than these little boys and girls who were being raped. That's pretty provocative language. You said in another statement to me, this is like Nazi death camp. I mean, let me finish. I'm just reading your words. I mean, what happened to these kids? 1 in 31 boys in this country, their minds are being robbed from them.
Yeah, I was not comparing the CDC to Nazi death camps. I was comparing the injury rate to our children to other atrocities. And I wouldn't compare, of course, the CDC to Nazi death camps to the extent that any statement that I made has been interpreted that way. Yeah, I don't agree with that. In 2003, the United States Congress Government Oversight Committee ended an over a year investigation of the CDC and used almost that same language. They said that the CDC, just one division, one branch, the Immunization Safety Office, had put institutional self-interest and pharmaceutical profits ahead of the welfare and health of American children. So that was a conclusion by Congress. And I repeated that.
I'm asking you because you're the nominee for HHS. It sounds like you stand by those statements.
Senator, my objective is to support CDC. There's nothing I'm going to do that is going to harm CDC. I want to make sure that our science is gold standard science, that it's free from that same government oversight investigation committee found that the panels, the ACIP panel within CDC, I think 97% of the people on it had conflicts. I don't believe that that's right. I think we need to end those conflicts and make sure that scientists are doing unobstructed science.
So I want to enter this statement, by the way, into the record without objection.
Without objection.
Last week, the White House gagged HHS and the CDC, preventing them from communicating all important public health information to anyone, including all of our allies, including our allies in the United States and global disease prevention. Can you just answer yes or no, because I'm running out of time? Do you agree with that action?
I was not consulted on it, but that's pretty much standard operating procedure for incoming administration.
So you agree with the action that gagged HHS and CDC from communicating important public health information to the public?
That directive made sure that no public health, that only non-essential travel and mass communications were temporarily suspended pending the confirmation of a new HHS secretary. This is standard operating procedure for every administration.
I get it. I don't think what we've seen over the last several days is standard operation for new administration. I think we're seeing some unprecedented actions, but you agree with it. Last night, members of the CDC, along with other federal employees, were actually invited to resign, these buyouts. And I got text messages and folks I know work from the CDC, for the CDC, that do this important work, who got that note. And it's really important because my experience is that when you send out that kind of note, the folks who resign are the folks who you least likely want to see resign. They got other options. They're gifted folks. They got a lot of expertise. They have options. A lot of them are doing this work because of their patriotism, because of their commitment. Do you agree with the buyouts that were presented to CDC employees just last night?
I agree the vast majority of the scientists and experts at CDC are patriots of good government service.
Can you tell me yes
I don't
or
think
no?
anybody's going to resign who's committed to making America healthy
Can you
again.
just answer yes? Okay, you agree with the buyouts. In our meeting, I asked you to confirm your support for the Affordable Care Act. You also mentioned that you and President Trump want to fix the ACA by making premiums more affordable. Can you answer me yes or no, as I don't have a lot of time? Did you know that tax credits that help families afford health insurance and save Georgians an average of $531 per month per person are set to expire at the end of the year? Did you know that?
I do.
We need to move on.
Do you support Congress extending these tax credits so that Americans can continue to afford health care?
Congress has to make its own decisions about that. My instructions from
Mr.
President
Chairman,
Trump
you're saying I'm running
is
out
to
of
make
time, but I'm having a lot of trouble getting the witness to answer yes or no to a yes or no question. And I've got one more question.
You're almost at 9 minutes, sir.
Well, I need him to answer yes or no. Yes or no? Do you
I'm not going
support?
to answer yes or no to a question that's not susceptible to an honest yes or no answer.
I can't
We
get an
need to
answer.
move on.
I think that the fact that you find it difficult to answer basic questions is deeply troubling for me as you present yourself as a nominee to run HHS. Thank you so very much.
Senator Smith.
I've been in courts all over the country and prosecutors.
Mr. Chairman, you told me I'm out of time, and the witness continues to filibuster even after I said I'm done.
Senator Smith.
Mr. Chair, thank you. Thank you, Mr. Chair and Ranking Member, and welcome, Mr. Kennedy. So, Mr. Kennedy, I don't have a question for you on abortion. I think that my colleagues on both sides of the aisle have covered this, but I want to say I can respect people who have different views than mine on this issue, but it's hard for me to respect people who won't give a straight answer to what they think on this issue in particular. Mr. Chair, I just want to note that I understand that anti-choice advocates have said that in these hearings they were looking to hear Mr. Kennedy provide some reassurance that he is on their side, and I'm not hearing that. And I think most Americans are looking for some hint that the decisions that people make about abortion should be personal and private, and they should be free to make those decisions without government interference, and I'm not hearing that either. To make it worse, the answers that you have given tell me that the Trump administration is more than willing to restrict or even ban medication abortion without a single act of Congress, and even in states where abortion is legal. And what is clear to me is that you and President Trump are dangerous to women's access to mifepristone. So having said that, I want to move to a different topic. Mr. Kennedy, I appreciate Senator Cornyn's questions about mental and behavioral health, something that I care a lot about. I know that you and your family have had personal experience with mental health challenges, as have I. And I agree that the mental health crisis in this country is a crisis. So let me ask you, in an interview in 2023 and again in 2024, you blamed school shootings on antidepressants. You said, and this is a quote, "There is no time in American history or human history that kids were going to shoot schools and shooting their classmates. It really started happening coterminous with the introduction of these drugs, with Prozac and with other drugs." So do you believe, as you've said, that antidepressants cause school shootings? This should be a simple question.
I don't think anybody can answer that question, and I didn't answer that question. I said it should
your
be
answer
studied.
is
I said it should be studied along with other potential culprits like
so they may cause
social media. But I don't know. I would never make, because there's no science on that,
Well,
Senator.
there is, Senator, there is, Mr. Kennedy.
Thank you for the promotion.
The science shows that there is no link between school shootings and antidepressants. And in fact, most school shooters were not even treated with antidepressants. And of those that were, there was no evidence of association. You know,
I don't think you
my
can say
question
that,
is,
Senator, because of HIPAA rules, nobody knows.
well, that is, Mr. Kennedy, do you think that people who take antidepressants are dangerous?
I think, listen, I'm not going into HHS if I'm privileged to be confirmed with any
So you can't say that people
to
who...
impose any preconceived ideas that I may have. I just want to have good science.
So you're not saying that they aren't dangerous, which means that they could be dangerous. Let me ask you this.
That's not true.
You've described Americans who take mental health medications as addicts who need to be sent to wellness farms to recover. Is that what you believe?
No, of course I didn't say that anybody should be compelled to do anything.
No, but you said they should be sent.
I said they should be available to them. I didn't say they should be sent.
You said that folks that take antidepressants are like addicts. That I can provide that,
Oh, I think
Chair.
they should have the availability. Listen, I know people, including members of my family, who've had a much worse time getting off of SSRIs than they did than people have getting off of heroin. It's the withdrawal period is, I mean, and it's written on the label.
I have some
This is
experience
very well
with this
documented.
myself, Mr. Kennedy. This is personal for me. When I was a young woman and I was struggling with depression, thankfully, I had the resources to help me get through it, including a new generation of SSRI uptake inhibitors, which helped to clear my mind, get me back on track to being a mom and a wife and a productive, happy person. And I'm really grateful for that therapy. So I have some experience with this, and I think that everyone should have access to that care. And your job as secretary is to expand access to care, not to spread lies and misinformation. And you know, the things that you say, Mr. Kennedy, they live on. They have impact. And, you know, we're having this conversation at the same moment that my Republican colleagues are looking to try to figure out how to save money any way they can. And so they want to cut Medicaid. Let's just think about this for a minute, because you're going to be, should you be confirmed, you would be responsible for CMS, which provides mental and behavioral health care to millions of Americans. Close to 40% of folks on Medicaid have a behavioral health condition. And you would be part of this administration that would be looking to cut Medicaid. So, Mr. Kennedy, these statements that you've made linking antidepressants to school shootings, they reinforce the stigma that people who experience mental health every day face every single day. And I'm very concerned that this is another example of your record of sharing false and misleading information that actually really hurts people.
Senator, you're mischaracterizing my statements.
I am only putting into the record what you have said, Mr. Kennedy.
You're mischaracterizing my statements, and I'm happy that you had a good experience on SSRIs. Many Americans have very good experience on it. Others have not.
That would be an issue between them and their physicians, and not for the future head of HHS to be putting out misinformation about the dangers of SSRIs and other antidepressant medication, spreading the stigma and the fear that we're actually trying to overcome.
Do you think physicians, when they make that prescription, ought to have access to good science?
Of course they do. And
That's all I believe, too. And you and I are in agreement, Senator.
And to your point that you made when you made these statements, it was not based on good science. I don't know what it was based on.
I was saying the science needed to be done. I was saying these are potential culprits. We're coterminous, and I named other things. I said video games. I said social media. I said SSRIs. SSRIs have a black box warning of suicidal, homicidal behavior.
Mr. Chair, I will submit to the chair the information that I have about what Mr. Kennedy has said, linking antidepressants to school shootings. Thank you.
Thank you, Mr. Kennedy. And as you know, I'm a big, have great reverence for your family from Massachusetts. When I got out of college, I was in the first class of Robert Kennedy Fellows, the memorial created by your family to honor the service of your father. I do community organizing in the west side of Chicago. And I certainly admire your energy in your effort here and desire to serve. You know, there's a couple of things that are really important here. This is not just about a debate on vaccines. It's a debate about qualifications, experience, and priorities as to the person that will head Health and Human Services. And it's not just about what your answers are today or what the questions are. It obviously has a lot to do with your whole record and your whole history. You know, your sister in her letter, or pardon me, your cousin in her letter said, you've always been charismatic able to attract others through the strength of your personality, willingness to take risk and break rules. That's, I guess, an attribute, but it can be a danger. The question I fundamentally have is whether your willingness to disrupt and maybe break rules is going to be dangerous and destructive. The character questions we didn't go into here, but there's some sketchy things you've acknowledged, your history with heroin. You've gotten over that, but there's incidents that do, I think, concern the question of whether the stability is there to be in charge of this major organization. And that's compounded by my concern that you don't have any experience managing a large organization, that you don't have any experience in government. So those are things that have to be taken into account. But the issue for me is also priorities. A lot of your engagement in health has been on vaccines, big important issue. You actually disagreed, as I understand it, with President Trump about Operation Warp Speed. I think President Trump deserves a lot of credit for Operation Warp Speed. He knew we had to get a vaccine. And these other issues about a mask and whether you should wear it, whether when you got your groceries, the bag had to be left outside, remember that in the very beginning? Those are incidental to the core question that the president believed we had to have a vaccine. And you contested that. That worries me. That really deeply worries me. The other questions, Senator Cassidy asked you some questions about our healthcare system. I happen to believe that our healthcare system is profoundly broken. And it's not just about the chronic illnesses. That's about our diet. That's about our exercise. But we are getting premium increases in Vermont of 20% a year, 25% a year. And it's busting the bank for taxpayers. It's busting the bank for our wonderful Vermont employers who care about having health insurance that they can provide to their employees. Senator Cassidy asked you a couple of questions about how you would reform Medicaid, and I didn't hear an answer. You mentioned that you thought Medicare Advantage was good. You have a good plan. No focus on what an incredible ripoff was reported in the Wall Street Journal by UnitedHealth, which was marketing Medicare Advantage and then paying doctors and nurses where they had assignments essentially to diagnose illnesses that didn't exist. So they made billions and billions of dollars. And I've seen nothing coming out of the Trump administration, and I've seen nothing coming out of your advocacy that is going after what is a rampant abuse by the insurance companies and overcharging people and not doing the job. And by the way, the UnitedHealth people, when they did that, they overdiagnosed. When the person really got sick, they dumped them. They dumped them. Go to the nursing home on your own. That's a broken healthcare system. We spend the most and get the least. And I think there should be collective anger about this on both sides because all of our people are dependent on that healthcare system. And you're going to be working for a president who's on a lawless rampage right now, okay? He has done something reckless with the pardons to these cop beaters. I'm appalled by that. But that's just reckless. That's not illegal. He's impounded money. So right now, the Medicaid website went down. He's impounded money. So the community health centers that Senator Warner was talking about are up in the air as to what they can do. Do you believe that a president can impound money that has been appropriated by Congress?
Senator, let me answer the question about Medicare first. I have never defended that program or the rapacious behavior by insurance companies or the PBMs. I understand that's a huge problem. And
all right, I don't have time. We've got to get over to vote. So we can do this.
But you've asked me 5 questions. You got to give me a chance to answer one of them.
Please be brief.
Yeah, I brought in, if I get confirmed, I've already appointed a general counsel. The first time in history is a former prosecutor who prosecuted the biggest Medicare fraud in the case in the state of West Virginia. I brought in a prosecutor for that job instead of a bureaucrat, precisely to address the important issues that you raised here. The only reason I didn't talk about these before is because I wasn't asked about them.
What about-
I agree with you 100%.
All right, what about impounding, a president impounding money that, among other things, goes to healthcare?
And you're saying that that's illegal?
That's correct.
Well, my job is to uphold the Constitution. I'm going to take an oath to uphold the Constitution, and I will administer the law and uphold the Constitution.
Two hours ago, colleagues, I asked Mr. Kennedy to reconcile his many anti-vaccine statements with his handful of pro-vaccine statements. Instead, he gave us a word salad and ducked the issue. The same was true, Mr. Kennedy, with respect to measles, where you wrote a book playing down the threat of measles, even though American families are very concerned about it, and apparently families are still mourning in Samoa. And my last point would be that Mr. Kennedy said today really wasn't about him. And I just want to tell him it is all about you, because I find your presentation to be both untrustworthy and unprepared, because my colleagues have been seeing back and forth between Medicare and Medicaid, and it's not clear which program you're using when. So I want colleagues to know there is a lot more information to learn about Mr. Kennedy before we vote. I'm going to urge that to my colleagues on both sides of the aisle to not make decisions on the basis of this session. I thank you for the additional time.